am here with Annika Lundstrom, who is the CEO of a company called Reminded. Annika and I actually only connected for the first time last week.
Yes.
So, Annika, thank you so much for being here. But as soon as I talked to her, I knew that we needed to have her at FIRE. I knew that we needed to have her come and speak at FIRE. And I think you're going to see why in just a moment. So I want to start off by talking about, this is not the first major endeavor that you've had in your life, right? Being the CEO of a biotech company is not your first rodeo. Tell me a little bit more about your athletic pursuits and kind of how you started off your young career.
For sure. Well, first of all, thank you so much for the very short notice of getting all of this together. I'm really happy to be here. My name is Annika Lundstrom, originally from Helsinki, Finland. Prior to my current medical device startup that I'm running, I was dropped into competitive sports for a very long time. So out of all of the random sports that you can start, I started table tennis from the age of 6. Eventually, I saw that there was much more potential for me to dive into here. So I qualified to the Youth Olympics back in 2018. Was one of the top 10 players in Europe in my age. And I definitely believe that this was the first experience that I had where I saw that if you dedicate your life wholeheartedly towards one pursuit, then there's great things that can come out on the other side.
So I already told Annika that we're challenging her to a game of table tennis once we get back to the resort. And whoever can compete at all and return her rallies will be given a medal. So I want to talk a little bit more about that experience, right? Because being a youth athlete, and especially a youth athlete at that level, is an extremely stressful experience, I would imagine. What was it about that experience that made you start thinking more about mental health? And what did that teach you about mental health in general?
Yeah, I would definitely say that being in such a competitive environment constantly and at the same age of 16, 17 years old, it's not an easy, scenario to deal with. So it just led for me to have a extended period of time where my own mental and physical health took a toll. And that was the necessary wake-up call for me to recognize this is such a fundamental aspect to live a whole and fulfilled life, which just naturally opened up my whole interest about dedicating my life towards a pursuit that I fully and wholeheartedly want to help out for. So I'm a molecular bioscientist by training, and then on the side of my studies, I started to build out the foundation of our current startup named Reminded.
Awesome. So let's talk about Reminded. What are you doing?
Yes. So Reminded is a medical device startup with the mission to become the leading solution in salivary diagnostics. Currently, our team is commercializing the first clinical grade handheld saliva test for cortisol, the main stress hormone, to be integrated into behavioral health care, specifically targeting PTSD care and addiction treatment, so that it can be driven from a more objective and data-driven approach.
And I'm curious, was there something about, so when you and I spoke on the phone, or on Zoom, the internet's new phone, you mentioned that one of the things that you found most useful about this is you're not just self-reporting, right? I think a lot of times especially when you're younger, but for everyone really, it's hard to talk about mental health, right? It's hard to say, oh, I'm starting to experience depression. And sometimes it's a kind of a slow slide, right? You don't necessarily notice that you're getting to a place where it's really affecting your health and your livelihood until it is. What is so important about having those kind of regular data-based approaches and check-ins to mental health?
Yeah, one of the main reasons why we want to help out for this industry particularly is that it's heavily reliant on subjective assessments, those standard questionnaires or interviews, or in rare occasions, traditional blood works for clinical decision making. But those methods are always going to be slow, invasive. It's not suited for continuous monitoring over time. So therefore, we see that this is an opportunity for us to integrate a marker that has been clinically and scientifically proven to have a strong correlation with these conditions that we want to target, and to provide to clinicians continuous data that they can integrate into their current treatment decisions that they make.
Are there other biomarkers out there that you would like to target for the future?
Yeah, definitely. We want to take this approach with cortisol since we see it as a marker that has been significantly risen recently in society. And it's also predicted now that 1 in 3 individuals have some sort of dysregulation in cortisol secretion. So what we want to do is basically build out a strong trust and foundation around this marker, prove out our tests in a strong way, and then be able to utilize our saliva technology into other markers in that biomarker or that sample of saliva. And I'm really happy to also see that in these other conversations today that saliva has been pointed out in many ways. And this is why we see that the timing is now for us to really rule the market.
So you chose to move. You visited San Francisco, I believe, and then you're like, okay, I have to live here. Can you talk a little bit more about why you chose to move from Europe to the U.S. at a time when so many people are choosing, especially academics and researchers, are choosing to move from the United States to Europe?
Yeah. So as I said, originally from Helsinki, Finland, I built out the foundation of Reminded on the side of my studies at the University of Helsinki. Then after, getting a little bit off the ground, I got the unique opportunity to be basically dropped in the Bay Area for a couple of months for this sort of government-run program for a few founders from Finland. And man, that whole experience just opened up my perspective so much in terms of what's possible for business. And I saw that our efforts were actually paying off much more effectively than what I was doing in Helsinki. So after that program, which ended in May of last year, I was like, look, I have nothing to lose here. I'm going to drop everything, give it my all, and move back here at the end of July. And at that point, I knew that in terms of funding and our financial situation was not looking so great, but these are the kind of sacrifices that you have to be willing to take in order to give yourself a fair shot. And now we're in a position where we've raised significant funding for us to succeed throughout this year, and yeah, we're powering through.
And where are you now? So you're in the middle of FDA trials, is that correct?
Yeah, so
what is the timeline for these cortisol strips to be in or tests to be in doctors' offices?
Yes, so our official team formation took place a little bit over a year ago, and that was also the time when I first came to the US. Ever since that point until now, we've raised a little bit over $1 million in funding. We're initiating our first clinical trials with a hospital here on the West Coast, submitting everything for FDA, with a potential approval by the end of 2025, early 26, which means that commercialization would take place sometime in 2026 for us.
I think anyone who's here who's an entrepreneur knows that is an incredible timeline. Yeah. That is so fast. And especially given, just where, you just came here and you're basically, that's an extremely accelerated timeline. So congratulations.
Thank you. But the number one thing that I really want to highlight here is not the speed of execution. It's building the actual trust in terms of what we're wanting to produce into the healthcare industry. So we have a chief scientific officer with a PhD in this particular biosensor field. And the only way for us to truly succeed and break into this industry is by clinically validating the saliva tests that we're wanting to commercialize, and comparing that against the golden standard of big laboratory machines that have the same level of accuracy. And this is how we can then look into long-term monetization or partnerships within this industry and really make a difference.
So we are going to have questions in just a minute. So if anyone has a question, feel free to come up to the microphone. But I wanted to, before we get to that, ask you a question, which is, when you think about the future of mental health diagnosis and treatment, what do you see the big picture being? I mean, clearly this test is just one little part of that. How would your ideal vision of mental health diagnosis and treatment look moving forward?
I see that we don't want to reinvent the wheel here in terms of the current standard of care, but integrate more objective data points to broaden the general health assessments that are being done for these conditions that go so widely unnoticed for such a long period of time, as you said. I believe that mental health care with rapid tests like ours and other things will ensure that those kinds of signals and patterns can be catched much earlier on, which then eventually will decrease the time of recovery for a lot of patients worldwide.
And how do you think about, so one of the things I think that is so often so key to good mental health in general is community, right? We have all over the world this intense loneliness epidemic which is being accelerated by phones and social networks. And how do you think about community as it relates to a patient's care? Like, are there, clearly this is a diagnostic, but really treating and caring for anyone with mental health requires a community response. And I'm just curious what your thoughts or experiences in that are.
Yeah, I feel like these types of objective approaches will articulate things that a lot of people have a hard time expressing on their own, and that people can feel less lonely in the dark by being able to communicate it with their peers at an institution or a clinic or wherever they're searching for help. So I highly believe that community will always be such a fundamental aspect for this industry, but this will even make it easier to break down the barriers between the patient and the clinicians.
Are there other, what are the future, so we've got cortisol, what's next?
Yeah, reproductive health is another huge segment that we want to target with our saliva test. So the great innovation with this particular saliva technology that we're utilizing, that it can be utilized for progesterone, estrogen, testosterone, inflammatory markers, drugs that can be detected in saliva. So we see a huge opportunity for pharmaceutical research as well. And that's how we can become the leading solution for salivary diagnostics in the long run and provide our services in a versatile way within the industry.
When you think about what you're doing here in the US and you think about Finland, can you compare, so you mentioned the funding is easier. What about the medical systems between the two countries, and how does the difference between those two medical systems influence how you think about your company?
Yeah. Funding will never be easy, for sure. But I would say that the US has given us a more chance to not have everything figured out before someone can give you a fair shot, which is something that I really appreciate. In terms of any clinical partnerships and how hospital systems are structured, I would feel that in the Nordics, they are a little bit more held back. They feel like, hey, we have it pretty okay here. We're not maybe so open to innovation as of right now. Versus here, I feel that there's a greater urgency of
we don't have it figured out.
No, I mean in Finland.
Yeah. No, I'm saying in the US we do not have it figured out. That's why we're so open to new ideas.
But yeah, I would say that those are maybe some key differences that I've seen or noticed. At least.
We have one question over here. Paul?
Your story
can
is...
Can you say
I'm sorry, Paul Shoemaker. Your story is incredibly inspiring. Coming here gives me hope. I'm curious about two parts of this. So you got this information. First of all, and you kind of talked about this, but how do you see somebody that gets a cortisol data point? Is it the patient that uses it? Is it they use it with their doctor? How do you just see how do you see that person actually using that in the right way? And secondly, do you worry about how that data can get spun right in the world we live in today? And how people could research it online and what they could do with it. And so what's sort of like the use case of how somebody uses it, and how do you can't do everything, but how can you kind of mitigate the risks of what anybody does with any data in the world today?
For sure. I would say that the most effective way that we can make a difference is by integrating this into more controlled environments and work with institutions and clinics who understand the value of cortisol. So the way that we're working, let's say for this trial now with this hospital, is that they have patients coming in for alcohol recovery for a 30-day program. We will be integrated into their current standard of care, where they have certain checkpoints throughout their journey. We take one test at intake, one at the 15-day mark, one at the 30-day, and then being able to track the patterns and seeing objectively what kind of difference have they actually made on their patients' health overall. And of course, the greatest value of our test will become more certain over like longitudinal data that can be tracked like over 6 or 12 months. But the first trial that we're starting now is just to validate the science and prove out the accuracy of the test.
Okay, we are out of time. Annika, thank you so much. I think you'll be around for a little bit if anyone has more questions, right?
Oh, yeah. That was one, yes. But yeah, thank you so much. This was great.